Janet, I'm glad that you're here today. Can you hear me? Janet, just want to make sure you're hearing me. I think you're on
I
mute. No,
can hear you. Yeah.
okay, great. Janet, where are you physically today?
I'm in Nairobi, Kenya.
Nairobi, Kenya. Well,
Yeah.
thank you for being here today. It's glad to
Yeah.
see you. What time is it in Nairobi?
It's going to some minutes to 3 p.m.
Okay, great.
Yeah.
Glad
Yeah.
that you're here. Glad that you're here. So, Janet is a researcher and humanitarian professional. I think you've been associated with the IRC. You've done work with the
Yeah.
IRC.
Yeah.
And she focuses a lot on maternal and infant health, I think, in South Sudan.
Yeah.
She is here today to talk about her work. We're really the topic of her presentation focuses on navigating humanitarian careers in crisis, and we certainly have our hands full of crises today. So, Janet, you should be able to share your screen. Are you able to share your screen? If you need to share something, I'm going to give you now for the next 45 to 50 minutes um, to tell us what you want to share with us this morning or this afternoon for you.
Okay. I think you need to stop sharing your screen.
I stopped sharing my screen, right? Okay, there. I stopped sharing my screen.
I hope you can see my screen.
Yeah, yes, I can.
Okay.
Yes, I can see it. Thank you, Janet.
Okay. Thank you all. It's great to be here and get to share my experience in the humanitarian space and talk about what has been happening, in the recent past. As I said, my name is Janet. I have worked in Sudan. My latest assignment was in Sudan. I've also worked in South Sudan and Somalia, but I am a Kenyan national and I have around 11, 12 years of experience. So this is like it's a very personal topic to me because it's something like I've literally experienced. It's yeah. Let me say that it's like been a very real experience for me. Currently, I'm working as an independent consultant based in Kenya, doing what I was doing in South Sudan, as well as Somalia. That is proposal writing, research, M&E across East Africa. So there are three questions that were shared before this presentation, just to answer what has changed in the last year, what pathways exist for young professionals, and what you should be doing right now. I'm going to talk about, in summary, there's a lot that has happened in the humanitarian space, but I'm going to talk about, USAID, WHO exit, as well as limits, job losses, and generally the shift that has happened. So what has changed? In very simple terms, I can talk about the biggest one has been USAID. That is a US government agency that was the biggest funder of emergency responses in Africa, in all over the world, really. It paid 42 cents for every dollar that was spent on humanitarian aid. What happened in early 2025, again, this is really common knowledge. Once the president came in, President Trump, that is, his administration froze all USAID foreign aid. And within weeks, 83% of the programs were cancelled. And I'm talking about worldwide. So it affected millions of people. More than 10,000 USAID staff were cut, and it was around up to 300. And I think like now, we're in 2026. I'm sure it's less than this, probably less than 100. And then by July 2025, USAID officially ceased to exist. Will USAID come back? Experts say no, because USAID was not just closed; it was dismantled. By the, Elon Musk and dog agency. It was literally broken up into pieces. So it's not like it's just going to come back. With the few USAID staff who remained, I think probably less than 100 were absorbed to current, I think, BAA, State Department. So for now, we can say it was like a structural destruction. The systems that were built over the years, we are talking about more than 50 years, were literally dismantled in less than a month. So this was, it affected a lot of us. I think not just me, a lot of humanitarians, simply because for the most part, we worked, most of our funding in some organizations up to 70% was from USAID. So this affected, not just me, all of us, and almost everyone else who's coming to the humanitarian space, because it has really shrinked. So this was the timeline. I won't repeat it, but this is like literally what happened. An executive order that came because we got the 90-day freeze. I think it was in January. I can say we knew, because President Trump had always talked about making changes, cuts. So we knew it was coming, but the speed with which it happened, it caught us off guard. Like we got the stop order. Programs were suspended almost immediately. I was working on a BHA project in Sudan, emergency response. I remember it stopped immediately because those contracts were, we got the stop order, so that meant everything had to stop. Even the workers we were working with from USAID, they stopped replying to our emails. We could not get them on calls. It was actually very shocking and very fast. And then, Marco Rubio announced that the 83% of USAID programs were terminated. Sudan was among the countries that were most affected by this as well. And then USAID was absorbed into the State Department. And then in January, that is now 2026, just 2 months ago is when now, again, the US formally exited the World Health Organization and terminated all contracts. So I can say the situation is now kind of even worse than what was there, because of just how the world depended on USAID and generally the United States of America. So specifically for Sudan, it is the world's largest crisis, and I've said this. USAID was among the biggest funders of emergency programs in Sudan. So with that cut, with the cuts coming, it made, I can say it's literally just made things worse. And till now, I can say Sudan it's just not good. Apart from not just from being the world's largest crisis, the lack of funding, it just made things worse in general. Sorry, this is a slide I was talking about. Sorry. So for the human cost, I can say health and nutrition programs were hit the hardest. And as you know, health and nutrition programs usually target women and children. So when they are touched, it means it's the women and children who suffer the most. So for PEPFAR, 20 million plus, people on HIV were at risk. Health workers lost jobs. And as you can see from this slide, it's affected literally every country in Africa, and not just Africa, but also in Asia, some of the poorest countries in the world. I think the Lancet had said there's going to be more than 14 million plus additional deaths projected about 2030. And when I was making these slides, I saw that there's new information. I think the Trump administration, they refused to release some contraceptives that were in some warehouses. I think the contraceptives are going to be destroyed. So that tells you what is going to happen, for maternal and child health and teenage pregnancies and adolescent sexual and reproductive health. So I can say the worst is yet to come. So again, this is very personal to me because I was among this and so many people I know. As of May 2025, around more than 200,000 people had lost jobs across humanitarian agencies. We're in January, so I'm sure it's more. Probably it's unverified, but I think up to now it's maybe around 300,000 people who lost jobs. Because of the budget cuts, of course, jobs had, to go. Different organizations reacted in different ways. In some CEOs took salary cuts. The CEO for IRC took a 20% pay cut. Others closed their offices. By the time I was leaving Save the Children in Sudan, they had closed 5 offices. As of January 2026, I think they've closed 2 or 3 more. Same thing for all these organizations you can see on that list. And these are the biggest ones. And you can imagine if they had this kind of impact, you can imagine now the smaller, the national and the local NGOs at the ground in all these countries in Africa we are talking about. So this was like a nutshell of all the jobs that were lost. This is, and again, remember, this is just because of your USAID. So you can imagine even the countries in Europe that also started reducing their foreign aid budgets. So you can imagine the kind of world that it is, what is going on right now. So there were talks that Europe was going to bridge in the gap. Immediately, when the USAID cuts started coming, there are a lot of talks around, Europe is going to come in, China is going to come in, Russia is going to come in, they're going to fill the gap and all that. But then again, with time, the reality has started to sink in and realize the gap that USAID and America generally left was too big to be filled. And even those countries on their own, the European countries on their own, are scaling back on the foreign aid that they are giving people. So you can see there, EU and Germany combined, it's only 16%. It's literally less than what the US was giving. So the gap that was left was over $60 billion US. And there's no single donor who can fill it. So that tells you the kind of gap that is there. It's just too big. Since the US left, it's very difficult for somebody to come and fill in that gap. And as I mentioned before, I think now everyone in the humanitarian world knows, USAID is not coming back. And even if it was to come back, it will take time for it to be built to the level that was there before, simply because it was like structurally dismantled. And experts estimate it may take even 5 to 10 years for full funding to be restored. So, and again, I'm pointing out, particularly for USAID, because a lot of Americans I worked with came in through USAID. So when USAID is not there for Americans trying to come into the humanitarian world, they'll have to find other ways. USAID is no longer there. So even the UN is changing. For a long time, it was USAID and UN. But even the UN is changing, especially considering that they pulled out the Trump administration pulled out of the World Health Organization, and they pulled out some few other organizations in the UN they were supporting. So for now, there are 43% fewer UN jobs since January 2025. The WHO and the International Organization for Migration are the most affected, because they also were among the ones getting their largest funding was from the USAID, or from the Americans generally, let me say that. The consulting roles are also fewer. A lot of entry programs like the YPP and JPO have also they were either halted, slowed, or closed down. So the UN, what they did was that they started shifting to the consultants, because generally consultants cost less, because they don't pay pension, no health insurance, generally no benefits that are afforded to regular staff. And that again comes with its own issues. And then, so now what this means is, remember now, USAID got out, UN is shrinking. So those jobs, those expatriate jobs that were there, the pool is really, really small. And consultancies are now the entry point to some of these jobs. And again, because of that change, that shift, it means, generic profiles are no longer working at this point. Skills, it's better when you have skills. It's a better entry point than in the past, where you, as long as you could just, as long as there was space, because USA had all these programs. They would send people to Africa. As long as you graduated, you knew somebody, you could just come. But now it's shrinking. So now that means you may have to have a skill that you can bring to the table. And also what this means, with the shrinking space, the changing to consultants, the income again is changing. For a very long time, expatriate salaries were good, because there was always a salary, the hardship allowances, the travel allowances. And with all these things changing, so that means salaries again are not really. You have to have a budget, and so that's something I'll talk about a bit later. People now have to start budgeting for things they didn't have to budget before, but now they have to do it. But I can say the consultant role is, for now, consulting and consultant roles are now the entry points. They were not there before, but now they are. So what pathways exist and where are the opportunities? So I can say now organizations are taking nationalization, localization, and nationalization a bit more seriously because of the budget cuts, and so many expatriates had to leave. So it meant national staff taking on some of these roles. Like my previous role was taken by a national Sudanese, and not just mine. I think for a lot of people I know, the positions that were left by the experts were ended up being taken by nationals. But this also ended up creating its own opportunities for the former experts in terms of trainers, mentors, and coaches, mostly because a lot of these nationals were also not prepared for these positions. As I said, the cuts, everything just came up. It was very fast. A lot of organizations were not prepared for this. I know a lot of my former colleagues who had very high-profile jobs. Now they've turned into mentors and coaches, and they are specifically looking out to mentor national staff, especially those in leadership positions, so that they can be able to take over the roles that the expatriates were doing. And also, a lot of these local NGOs have gaps. They have capacity gaps, especially when it comes to grant writing, finance systems, HR. And I know some of these former staff they are coming up with consulting firms, taking up this coaching, just to prepare national staff to be able to handle and conduct some of these roles that were left by expatriates. So the second one, where are the opportunities? I can say consulting is becoming one of them. Proposal writing is one of the most in-demand skills during downtowns, because it generally tends to be the hardest. It's like one of the hardest skills in the NGO world and the humanitarian space is writing proposals, especially for big donors. So that is something I know also a lot of my former colleagues who are laid off are going into. And also short-term evaluation and research contracts are available. Like in my case, that's what I've been doing since I left the humanitarian space. Because again, research and evaluation are very technical areas that, again, in some countries, national staff were just not prepared for. So that is something, like for me, I've been able to do that. And also a lot of training, facilitation to grow alongside the localization agendas. I also know a few colleagues who've taken on strategic advisory roles for these small and local NGOs, again, just to help them come up with speed on how to manage and deal with the gap that was left by the expatriates. And then also something new that's really coming up is the tech and the data roles. That is GIS and satellite analysis. This is something that's very new. Once you get time, I would encourage anyone who is interested in this space, just go look for the Yale Humanitarian Research Lab and ACLED. There are many others, but I'm particularly singling out these two because I saw what they were able to do in Sudan. Mostly document the genocide using satellite. They were able to document what was happening in El Fasher, and the UN was able to use the evidence that was generated to declare what was happening in North Darfur, El Fasher, as a genocide. And also they track a lot of movement. So just by tech and data, they've been able to do a lot. So that is an area I would strongly advise, especially for young students and professionals who are interested in the tech and the data roles. Just look for the Yale Humanitarian Research Lab as well as ACLED. There's also a lot of OSINT, tracking conflict, documenting violations remotely. There's also gaps and a lot of opportunities for data analysis and programs for donors, and also AI-assisted translation, reporting, and proposal drafting. These are very new areas. So these are very opportunities that technology and data can be used to as an entry point. So there's also the adjacent sectors. They are coming up. They're still not as strong, but they're coming up. I'm seeing a lot of interest in climate and environment, especially now that it's becoming closely related to a lot of conflict in Africa generally. Peace building, conflict analysis, mediation, DDR programs. Like in Sudan now, I know there are quite a number. And also, and not just Sudan, I think even Gaza, Yemen, Ukraine, the opportunities are there. And development consulting, and to a lesser extent, we have the private sector, CSR, impact investing, as well as corporate social responsibility. So specifically talking about jobs, as I mentioned, because it has changed so much, the humanitarian and the peace building space. So now it's taking, on average, it's taking 6 to 12 months to find a new job. Before all this, it was very easy. Like for me, I can say I never used to struggle to get a job. Like literally from the time I entered the humanitarian space, I have never struggled to get a job because they were always there and there were so many. But this is the first time where, you get off and you just can't find work. I'm in several communities in LinkedIn and in social media, and it takes an average of 8 months to get a new job. Then these are some of the comments I got from my networks. People are, looking, they are attending interviews, they are doing the written assessments, and then they just never get the job. And, this is closely tied to the fact that there are so many of us right now, 200,000, even more, maybe even up to 300,000 humanitarians left. USAID alone was more than 10,000. So we are all competing for the very few jobs that exist. And there are people who are saying that they're even quoting lesser salaries and they're still not getting the jobs. Because now I think we have all adjusted to the fact that the USAID salaries are gone. So a lot of people are actually willing to go lower, but they're still not getting jobs. And I think there's a HR person who was saying that even for one position, you can even find 600 applicants for that same position. And they are all qualified because we are all technical people laid off at the same time. So now it's just harder. It's just, it's harder to get a job than before. So for now, it's mostly networking. For me, when I look back, I realize like all the jobs, all the consulting jobs that I have were like networks. I applied. I was facing the same issue these people are facing. You get shortlisted, you do an assessment, you do the second interview, you share writing samples, and then you just don't get the job. But the ones that I networked with, the people I worked with, that's how I've been able to survive. So for now, mostly networks. That's how people are getting jobs. So this is slightly a repeat of what I was saying, but these are the new tech skills that matter the most. I can say in the humanitarian space, the rest of the world is moving to technology, AI, GIS, same thing for the humanitarian space. These are the new areas that you need to look out for. And again, this is just like a study I talked about Yale Humanitarian Research Lab. They use satellite imagery and GIS to document human rights violations. And again, this is just some of the new ideas, new areas for people to think about. So for the skills to learn now, AI is replacing some roles. Learn to use it. So for example, for a very long time, we used to hire translators. Sudan is an Arabic-speaking country. So whenever we design tools, a lot of things we used to we write them in English and then you hire a translator to do the translation. But now this has changed. It literally stopped overnight. For example, like I know Microsoft Excel has now a translate function. You can literally design a tool in English, and once you hit the translate function, it will translate an entire questionnaire to Arabic. So what the Sudanese now are doing is just to go through the Arabic versions and just check to see it is correct to the Sudanese dialect or the Sudanese context. And one thing I keep hearing is that it's actually quite accurate. In a long time, people would use Google Translate, but Google Translate was tailored more to modern standard Arabic. But now with the new, with the new LLM, the new large language models, if you put in even like Sudanese Arabic translation, the Sudanese dialect, the translation is almost coming out to be not perfect, but good enough that a Sudanese can just go through the tool within 1 hour and they'll be able to contextualize the tool to Sudanese Arabic. That's just how good AI and the large language models are. A lot of things also that used to be done manually, now pipelines are being created. Once you have a tool in Kobo, the data is collected, literally can be done through Python pipelines. I've seen people creating GitHubs. It's a lot of things that were being done manually before, now it's almost automatic. So this is another very good area to learn, to think about and learn. So that's that particular slide there, the high value skills to build a lot of GIS, QGIS, OSINT, AI prompting. So these are now becoming, this used to be very like a by the way, nice to learn, but now they're becoming more mainstream because of how helpful they have been to the humanitarian space. So what should you be doing right now? Some of the things you can think about. First you have, as a humanitarian, you have to understand the sphere standards. It's the humanitarian rule book. Of course, there's a project management cycle, proposal writing, log frames, AI tools, as I mentioned, a second language, but I can say this is now becoming less and less. It used to be like something very almost like a must, but now because of what technology can do, the second language is good, but you can manage without it. And then get the necessary experience if you can. Right now, I know it's a bit difficult, but the opportunities are still there, especially with small local NGOs, field placements, even if even the short ones count. Local NGOs are still there, and as I mentioned, they have capacity gaps that expatriates and people with good skills can fill in. Proposal writing, even if it's strategic and paid work, because it's something I've seen some of my former friends do. And also very important is building your network. As I mentioned, going through job boards is no longer quite effective. So you start building your networks now. Identify the NGOs you'd like to work in, the areas you'd like to work in. Go to LinkedIn. Look for people who work in those areas. Follow the new humanitarian. Look for jobs on DevX, the Relief Web. It will give you an idea of what you'd like to do, see what they are doing, and see how you can, network and connect and know these people. Also finding mentors. If you know anyone who's working in that space you are interested in, connect with them. They can be able to guide you, and you'll know what, how you'll navigate and maneuver. And so this is a bit of staying in the field. I can say that the humanitarian space is not easy to work in. It's one of the hardest areas to ever work in, when you're surrounded with so much destruction and death and bad news, and it's a very even if remote, this is something that was, even for me, I found surprising, because for a long time I worked immediately after the crisis in Sudan. As we were expatriated, all expats were we were sent back to our home countries, and I had to work from home for some time, but it was still very difficult, because you've left your friends in Sudan. They are telling you they are running away, they can't find their family members. So it's a very difficult place to work in. But I can say you have to be very prepared for it. First of all is the financial. As I said before, getting jobs in the humanitarian space was quite easy, but now it's very difficult. You must be prepared for very long times. You will apply, you may not get a job. And most importantly, this was one of the most important things you can do, is building an emergency fund. Even before leaving any role, emergency funds are a must, at least 6 to 12 months. Before it was 6 months, now it's up to 6 to 12 months. Also be prepared for lower salaries. As I mentioned, the USAID salaries are gone now. Most people now have to do with consulting income, and consulting income really does not come with benefits. No pension, no hardship allowance, no health insurance. So that means you have to put in your consulting rate. But at the same time, remember, you're competing with hundreds of people who are going to quote lower and lower and lower. Now you're competing on price. So consulting income is probably can even be less than 50% of the salaries we were getting before. And again, the basics, don't work without a contract, track your invoices very closely, because again, in the consulting space, and this is something I face every day, late payment is very common. Unlike salaries where you get a salary every month or every 2 weeks, consulting tends to be deliverable based, so there are always late payments. And then try as much as possible to get several clients, not just one. And for personal, I can say unemployment is hard, especially for those of us who it caught us off guard. Like we were working, and then the stop orders came, and then contracts were not renewed. So for some people, the employment was almost immediate. It happened like overnight. I know a lot of friends who are struggling with this, the unemployment, that vacuum is, it's tough. So it's something you have to be prepared for your mental health. Of course, spending time with friends and family and your community. And also the aid sector can consume your identity. So it's a good idea to step back occasionally and at least spend maybe a day or two completely off any humanitarian news. Just make sure you can, stay grounded. And having weekly structures, of course. And of course, you have to remember that this is a systemic crisis. It's affecting everyone, so it's not personal. If you apply for a job, if you apply for a consulting gig, and it doesn't come, it's not a personal. It's just a systemic thing that came and affected everyone. And of course, for professional, you have to keep. I hope you can see my screen. Sorry.
Yeah, it moved, Janet. Yeah, it says you are now sharing, so I don't know. Now I'm seeing, okay, it keeps kind of reorienting itself. I see you now, but I don't see your screen.
Okay.
And provided we can see you, that's wonderful. If we can't see
Okay.
your screen, that's okay.
Okay. Yeah, I think I was on my last slide anyway, so I think I can just finish. So yeah, I think my last was again networking, making sure connect with the right people, areas that you're interested in, using the downtime to learn the AI tools, GIS, and how they can be applied in the humanitarian space, as well as staying active on LinkedIn, considering the adjacent sectors I'd mentioned, like climate, development consulting, as well as just talking to other humanitarians, both experienced and new ones, just to make sure you're in the loop of things, and also support each other, because it's a very tough time for all of us. And try to share.
I so I've got several thoughts and observations, and you've raised some really significant things. I don't know. Am I cutting you off? Did you have anything else to say? I'm sorry, Janet.
Yeah, I think I can. Let me just finish. I'm on my last slide.
Sure, of
Now I
course,
can.
of course.
Yeah.
Okay, now we see your slides again.
Okay. So yeah, this is the last slide. So there, just for 6 things to remember. So yeah, USAID is gone. It's going to take at least 5, even if the government changes after President Trump, it's going to take at least 5 to 10 years to rebuild. So it's good to plan accordingly. And as I said, I think probably it was, I don't say it was a good thing, but I think in a lot of ways with USAID gone now, it forced the entire industry to rethink itself, because we were very used to USAID. We were used to the USAID money. We were used to the USAID good salaries and good per diems and what it gave us. But now, with that gone, it has really, really brought a fundamental shift to what aid means and humanitarian means. So this is something now everybody has to reconsider and take things and think very differently. I can say Sudan is the largest crisis in the world and also the most ignored, because everyone focuses on Gaza and Ukraine. So there are still a lot of opportunities in Sudan. So this is something, and experience there stands out. So don't underestimate it. I know a lot of people, again, tend to focus on Gaza, Ukraine. Sudan is also one of them. So 6 to 12 months is what it takes to find a new job. It's the new normal. So you have to build financial resilience before you need it, not after. And as I said, even for me, I never used to struggle to get a job. This is the first time I'm seeing where I'm struggling, and not just me, everyone else, because we are all competing for the few same jobs. Learn new skills, learn AI, GIS, OSINT, and how you can apply them in the humanitarian sector, and use that to make yourself unique, make yourself different. As the international NGOs exit, the national NGOs are now taking on roles that international used to do. So there are new opportunities in that in itself. The localization and consulting is creating new opportunities. It's a good opportunity to develop your skills. And also, most important, protect yourself. Remember, this is like a systemic issue that is affecting everyone. It's not a personal failure. It's not a moral failure. And the field needs you. So you have to protect yourself mentally, keeping that resilience. Yes, and I finished my presentation. And thank you for being here. It has been really good to talk about this.
Yeah, I,
Yeah.
thank you, Janet. I imagine it's cathartic talking about this.
Yeah,
I
it
think in
is.
some respects. And you really gave us the waterfront, as we say, of what's going on, tying a lot of things together. Um, Lots of observations, and I want people to put some questions in the Q&A, but let me ask a few things to start off. One is, it's something that I hadn't even thought about until you mentioned it, foreign language skills. are we really going to need foreign language skills? I mean, when you're talking about Arabic, that AI can differentiate between different forms of Arabic, which I just find amazing, right? That this need that it was always, I would tell my students, oh, if you want to go to Africa, learn French, or, wherever you're going to go, or you're going to learn Spanish, or you're going to need to do all of that and so forth. And, learning the language gets you into the culture. I mean, AI is never going to get you into the culture the way learning a foreign language is, and I mean, you're Kenyan. I mean, most NGOs are operating in English. But we still want to encourage people to learn local dialects and foreign language. So what do you think that means for like language instruction, in this world?
Yeah, that's a great question. I think it's a bit of a balancing act now. It's still good to learn a foreign language. It has its benefits, especially when you go out there and you interact with the community, you
Right.
talk to people. So in that aspect, learning a foreign language is good. But what I saw is that when it comes to work, when it comes to doing actual work, is when now the difference now becomes a bit more minimal. As I said, I remember we would hire translators. We would collect
Yeah.
data, we would write proposals in English, and then we would hire translators to come and do it. But once we started seeing that, AI could actually do this, one of the budget lines I remember that was removed was that one for hiring translators.
Oh,
So
wow.
it's no longer it's still good. Still a good thing to learn, but it's no longer the differentiator that it was. Maybe for other languages it would be, but I know for Arabic, the Sudanese nationals are now doing it. Like they just design a questionnaire in English, they translate it on, either using Excel or a large language model. And then once they get the output, they review it to make sure that it's actually culturally and contextually correct. And that can take even a few hours.
Right.
Previously, it would take even like a week. Now it's gone down to a few hours. So I can say maybe for learning a new language, for speaking out there, it's an advantage. But for work, maybe not so
Yeah.
much. But then again, my experience is it's only in Arabic. Maybe French, Spanish may be different. But yeah, I can say that the new technology has also affected some of the things that we thought were very important and very key.
Right.
Yeah.
Right. Right.
Yeah.
The other thing that, I had a conversation about 2 months ago with a friend of mine who works for, it's Handicap International. He's British and he's actually the country director in Ukraine, and he's been many different places. And he says the field has contracted by 50%, basically,
Yeah.
in the humanitarian space. And it's not just USAID when they went away, then the Brits and the Germans, everybody has contracted what they're doing, right, in a sense. So the space is really contracted. And one of the ways that NGOs are saving money, and you've kind of mentioned this, is that so you always had two tiers of salaries, right? So
Yeah.
you had 100 workers, and 20 of them were Westerners, Americans, Brits, whatever. They were paid at a different rate than the nationals, the local nationals.
Yes.
Now
Yes.
those higher salaries are going away, right? So they're
Yes.
firing locals, and once again, they're not giving them any benefits or anything, right? So
Yeah.
they're still trying to hire people, but they're cutting the salaries and they're cutting the benefits that come with that. Less so for Americans, like, if you think about people in the West who say, well, I want to go work for an NGO in, say, East Africa, they're going to be less positions because they're not going to want to pay me that kind of salary, right? Are
Yeah.
you seeing that also?
Yes, yes, I have seen that also. Yes, as you mentioned, for a very long time, and I remember this has always been quite like a controversial issue. But yes, almost all NGOs had two-tier salaries. There's what the experts made, and there's what the locals and the nationals made. In some cases, the difference would be up to 4 or 5 times. So
Mm.
yes, that was a common thing. And again, this was mainly tied to the donors, and some of these even benefits were more of, like, for example, if USAID gives a contract, it came with conditions, and some of those higher salaries were part of these conditions of, for the donor. And so now with that gone, it means those opportunities for experts are less. And I mentioned it. I think now everyone knows that those kind of salaries and the benefits are gone. If you really want a job in what is there right now, you no longer have you can't expect those kind of salaries anymore. You might have to take on very, I can say, not as of course they'll not go to the level of the national staff salaries, but I know it's maybe once or twice, and of course the benefits are gone. Right. So now, it's you just have to be mentally prepared that those salaries are gone. I can say that. Yeah.
And the other thing you talked about, what you should be reading, what you should be following. I read the New Humanitarian every day, so I'm a big believer. And for anything, I mean, one of the things you recognize is, yes, Sudan is the worst humanitarian crisis on the planet, but nobody talks about Sudan. Right. And we can't be driven by the major media outlets. So another story about Iran and Gaza, and my heart breaks for Gaza, but I can't forget about what's going on in Sudan. But the media is not driving us to that. We don't hear about Sudan. So that's really heartbreaking. I follow DevEx using your LinkedIn profile. I think LinkedIn, it's not everybody's cup of tea, as you will. A lot of people don't feel comfortable in LinkedIn because you have to put a photograph and you kind of talk about yourself. But I do think, particularly for people who are trying to connect with bigger NGOs, kind of doing that thing, it's important that they do that. This idea of an emergency fund, I had not heard that. This is your own emergency fund, in a sense, right? I mean, that's a remarkable thing for people to have to think about, isn't it?
Yeah. Yeah, I mean, a lot of us had to do it. We didn't have them, but now we do. You have to have it because, you must have it. It's no longer like a choice. You must have an emergency fund because like I said, it caught everyone off guard. A lot of people were caught off guard, and most NGOs, especially the ones that are funded by USAID, were at will companies. So when the stop order came, we were told, if your contract, for some people, they waited until the contract ended. For some people, immediately the stop order came, they were let go. So they were not prepared at all. And you can imagine for people who were in Kenya, in Africa, so especially those with families, now you have to repatriate your family back, and you have to now, a lot of people had to use their savings, their pension, liquidate their investments so that they can take their families back. It's now the emergency fund is a must. I think now everyone in the humanitarian space knows that it's no longer like and in the humanitarian space, and like I know a lot in the tech space, people always talk about severance. Once your job ends, you can get a severance package.
Right.
But in humanitarian space, there's nothing like severance. I don't think there's anybody who has gotten a severance. So the moment they let you go, you walk away. You just like that.
Get your box, clean your desk out, walk out the office. I mean, everything. The severance doesn't exist. Something else I thought about, Relief Web. Do you think Relief Web is still a good place to go to look for work?
Yes, I think Relief Web is very good. But again, at this point, okay, so Relief Web is good for looking for work, general information on the humanitarian space and giving you ideas of where you'd like to work. But I think as of now, networking is still the best and the easiest way to get a job, because everyone will go on LinkedIn, everyone will click on that link to apply for a job, and everyone will apply for those same jobs. But if a HR or a recruiter gets 400 applications for one position, if there's somebody else who went in LinkedIn or just found a way of connecting with the HR or with that company, it's probably easier, an easier way to get a job right now. But yes, Relief Web, I believe it's good for in looking for jobs, getting an idea of where you'd like to go. But if you really want a job, you'll have to take like extra steps.
What do you think? Let's say I'm someone and I've been looking for work and I can't find work, and I have a relief fund and I want to go back and do some training. Take an AI course? Is that something I should do? What should I be doing now with? I used to say go study M&E, right? Because that's
Yeah,
M&E is still important, but now I would say maybe go learn AI. What do
yeah.
you be doing?
Um, I okay, I would not advise anybody to like go back to school per se. What I would advise, so for example, if you check an humanitarian, if you check DevX, if you check Relief Web, there's always this. Sometimes they add even Kaya, humanitarian
Mhm.
in the humanitarian space. There's always these short courses they encourage people to take. I would encourage people to do those ones that are very closely tied to the humanitarian space, because a lot of times these are very, when you see them advertising some courses, it's because they've noticed a gap and they want to fill that gap. So it's something that is, like I say, very closely connected to the market and what these organizations want.
Mhm.
And also, again, connecting on LinkedIn again with humanitarians. I mean, I know not everyone is comfortable with LinkedIn, but I still feel in a lot of ways it's also another very good area, because that's where all the humanitarians are. That's where they discuss, they comfort each other, they help each other, they talk. So those are usually good places to like find out what is needed and how you can fit in, and what skills you might need to fit into and network into those spaces.
Yeah, yeah, thank
Yeah,
you. I am
yeah.
looking, I want people now to put some questions in the Q&A. We've got a couple minutes. If you do that, but there's a question in the chat. So let's see. I'm not gonna identify the person, but I'll ask the question. I've been looking for an expatriate role, but language and age are hindering factors. Also, in my experience, connections have never worked for me. How can I start or initiate this connection? Can the host of the meeting support me in this field? I guess that's directed to me, maybe, or maybe it's directed to you. But let's talk about expatriate roles, age, factors. Tell me a little bit of what you're thinking there.
Okay, so expatriate roles and age. I'm not sure. I don't know what the age of the person is. I'm not sure if they mean they're older or they're younger.
Do you find that there's ageism? Is there age
Yes,
discrimination? Okay.
yes,
Okay.
yes.
Okay. Okay.
Yes. So let me explain it this way. The expatriates I worked with, especially from USA. You find that they started their careers in the US. Maybe they came to Africa or Kenya when they were young, when they were teenagers. They came maybe for holiday, or maybe they just came to volunteer with an NGO, and then they decided they like it. So when they went back to their countries, they looked specifically and did courses in let's say development, diplomacy, such things, and then they started their careers with NGOs in the United States, and then they started maybe even as officers in the USAID or USAID adjacent NGOs or bodies, and once they worked for a couple of years is when now it's like, yeah, because so what happens, for example, if you work in USAID has used to have like departments. There's a department for Africa, there's a department for Asia, and all that. So they would work there for a few years, and once they understood the system well, they would be posted to Africa. So most of the time, these are people who came with 10, 15 years of experience.
Mhm.
It's very hard to get an entry level job in Africa if you've not, let me say, worked and moved up the network in America. So most of the people actually they started their work and they got the experience when they were still in America. So by the time they were coming here, they already have the networks. They know the people. They understand the funding. They knew how to network with the governments in place. So I can say that's the network most people do. But it's very difficult to let's say you graduate today, and then the next year you come to Africa through USA. That was I don't think I saw such. Most of the people worked in the US first, and then they came later.
Okay. Okay.
Yeah. Yeah. And I can say expatriate roles are now really, really reduced. I think now, I mean, they're still there, but I know they're very reduced now.
Okay.
Yeah.
Okay.
Yeah.
Thank you, Janet.